Hey, this is Joe with Grandview Aesthetics and Plastic Surgery. Today we're here with Dr. Nanda to talk about DIVA. Doctor, what is DIVA?
So DIVA is a technique that we use that's non-invasive that can help improve women that have incontinence issues or vaginal laxity.
What exactly is incontinence?
So incontinence is something that a lot of women suffer from. It doesn't necessarily mean that you've had babies. That is one of the most common ways to get incontinence, but a lot of women that have never even been pregnant have incontinence. So that is when you have urine leakage. It could be like when you're jumping on a trampoline, you're laughing, you're trying to get to the bathroom, but urine leaks. At times you don't want it to.
And how does this relate to vaginal laxity?
So vaginal laxity is usually from trauma, surgeries, childbirth, those types of activities. And that is when there's a little bit more looseness of the vaginal tissue and the vaginal lining. What DIVA does is it actually can improve both incontinence and vaginal laxity, which then in turn will actually improve your lifestyle in several ways. Number one, when we improve incontinence, you don't have to take medications anymore. You don't have to run to the bathroom as much. You can control your urine control, which is what we all want. And this is with a simple 3 to 8 minute procedure. There's really no pain with this procedure. There's absolutely no downtime. You can return back to your normal activities. You can go do anything you want. You can go back to work the same day. There's zero scalpels, there's zero shots. There's really nothing else. You just come in, you quickly numb for about 30 to 45 minutes. The procedure, like I said, is under 10 minutes and you're out of here and you go about your normal activities.
Is it a laser procedure?
Yeah, it is a laser-oriented procedure, and we use our device called the Cyton to perform the procedure.
And what exactly happens with the Cyton?
So what you do is you're actually very comfortable. We numb you up first, and then we do the procedure, and it actually is going through and kind of making circular channels in the anatomy. And what that does is it causes collagen remodeling, and that will actually cause vaginal tightening. It pushes things up back to where they need to be, and that is why it eliminates a lot of more expensive surgeries, a lot of medications. It's an excellent procedure. It's received amazing reviews from many different sites, as well as all of our hundreds of patients that we've done this on.
Is it an internal or external procedure?
Both, actually. It's a great question. So internally, it'll actually tighten things and do those procedures that I mentioned earlier. Externally, it actually causes vaginal tightening, so things look a little bit more aesthetically pleasing.
When you come in for the treatment, how long does it take before the procedure starts? And is there any downtime right afterwards?
So when you come in, actually, we're going to numb you for about 40 minutes, 30 to 40 minutes. The procedure is about 10 minutes. There's really zero downtime. You can return back to any activity you like. Go right back to work. It's not a very painful procedure whatsoever. Women say it's about a 2 out of 10 at worst. We make you very, very comfortable, and you can return back to regular activities.
And is the procedure hot or cold?
So it's actually, it's kind of more hot than cold, but it's not painful. It's not uncomfortable in any way.
And when people think lasers, they think of like laser beams and light. Do you actually see anything from the procedure?
Nope, you're actually just hanging out, you're wearing glasses, and we're talking, we're having a conversation. It's done before you even know it.
And how long does it take before the incontinence or vaginal rejuvenation actually takes place?
So you'll actually start to feel benefits in about 2 to 4 weeks. So very quickly you'll start to feel the benefits.
And is it a single procedure?
So it's 3. We usually start it with 3. So you do 1 at day 0. You do the next one in 1 month. You do the third procedure 1 month after. And then after that, on average, about every 12 to 14 months, you come in and you do 1 more procedure to maintain it. Now, a lot of women only need 2. They don't need the whole package of 3. They save that third one for 6 months to a year later. And then we kind of judge, depending on how bad the tissue is, how bad your incontinence is, what the frequency of you returning is. But on average, about 12 to 14 months.
And does someone need to come in for a consult? How is it determined if this procedure can help them?
Yeah, so consultations are free. You come in, you speak with me. It's a very simple 15-minute consultation. I'll answer all your questions. Consultations are free, and then you go ahead and schedule a procedure. So very often we can do it the same day. Other times we may want to schedule it in a day or 2.
And how can they make an appointment?
So you can call us at 614-421-SKIN or in our Dayton office, 937-705-9430, or you can visit our website, greatskinohio.com.